So basically, on the first third of craniocervical flexion, it's only working from occiput down to C3 in 1/3 head and neck flexion. So most of your headache patients only work on 1/3 head and neck flexion. So I will start with him and say, okay, now rotate your cranium 15 degrees. Lift your head 1/3 of an inch. That's enough. Now touch your chin. And that's the activity of the rectus capitis anterior minor. Relax and let go, without incriminating the lower cervical spine. So I say, rotate, lift 1/3, and go back, and release.
So they go back to try and push
So when they're pushing back, they're stretching the muscle, but they're activating the rectus capitis anterior minor. So when they contract the anterior, they relax the posterior.
If someone had a sticky C1, would you have them do it close to yourself?
No, you have to, no, wait. You will prepare that. We haven't done that yet. I'm just showing that we're going to work only on the 1/3 range of flexion. So for us to do that, we prepare. We distract. We do a dorsal glide. Once I say I'm in the dorsal glide, I let go, and I say rotate your head back actively. You contract the rectus capitis posterior, relax. Now when I say relax, I distract, do the dorsal glide, anteriorly rotate actively, and now I do an over rotation. I stretch the rectus capitis posterior minor without breathing, relax, let go. Now you can breathe. Okay, don't forget that you're producing some obstruction of the airway. I distract, I do a dorsal glide, and make sure that the atlas is tightly held to the dents. Then I say rotate back, relax, I distract, do a dorsal glide, actively rotate anteriorly, and then I rotate over rotation of occiput on the upper cervical spine, relax and let go. I mobilized occiput away from C2. I stretch the rectus capitis posterior minor and major. Now I say rotate anteriorly, lift your head 1 centimeter, and bring your chin back and stretch the rectus capitis posterior minor. So when he's doing the anterior rotation, lifting 1 centimeter, and he presses back, he stabilizes the anterior arch of atlas on the dents and stretches the rectus capitis posterior minor. Relax and let go. But you only work on about that much of elevation, very short. And stretch. Relax. And I have to do all this only to prepare the space between occiput on C2 to be able to derotate atlas, to get rid of the crowding, and to lubricate the joint surfaces, because those joint surfaces are very dry. Up, there, relax. I do a gentle distraction. This is very easy now. I can feel how easy it is for him to side bend towards the left and side bending to the right. Can you feel that? It's good. It's butter inside. All the spaces are open. So now, I'm going to take this off just for demonstrations, but I will probably keep it. Atlas was rotated to the left. I have to rotate him to the right. Yes. We'll try. You're not looking. So my pure axis is going to be just 1/3 side bending. It's going to be 1/3 posterior rotation. And it's going to be 1/3 rotation to the right. The neck is exactly in the same position. The only thing I have changed is a little bit the position of the cranium. My right hand stabilizes the cranium on that side. I say, hold your face towards my hand. Stay in that position. I have two possibilities. I say, rotate your head to the right, rotate to the right, your head, and I resist isometrically. And I'm demanding the infraoblique muscle on the right side to hold atlas a little bit rotated to the right. Relax.
You're not blocking C2 though.
No, nothing. I'm just blocking C2 by the side bending of the head with the alar ligament. So I'm just working with the inferior oblique by now. Then, now my axis of side bending is here. I side bend him a little bit more on the right. I posteriorly rotate him a little bit more on the right. And I rotate him a little bit more on the right side. The cervical spine is absolutely vertical. It's only the cranium that is changing. And he's giving a good support of the head on my hand. Rotate to the right. Hold on the right. 1001, 1002, 1003, 1004, 1005, 1006. Relax. Let go. Now I have to side bend him a little bit. That's as far as I can go in side bending. Rotate your head back. That's as far as he goes into extension. Rotate to the right. And that's as far as rotation. Pure rotation. Here, here, here. The three axes. If your cervical spine moves a little bit this way, come back to neutral. I may distract in that position. Rotate to the right. Hold on the right. Relax, let go. Distract. Bring him back to neutral. Unroll him. Give him a little bit. You did muscle contraction. Muscle contraction is synonymous of intra-joint compression. So you relieve the intra-joint compression by doing kind of a courtesy distraction. You may tell him, okay, now do a little bit of nodding for me. Just to relieve the tension. You distract. Take him back to neutral and correlate. Now go towards the right. A little bit limited to the right. That's good.
Is it less to the right, or is it the same, but it looks like?
It seems to be less, but it's slightly less too.
Okay.
You overdid it.
So,
More than a millimeter.
it's going to cost you more. You know. Now, come back 2 days later. Come back, long axis distraction.
How does the C1 feel?
I'm not going to even touch it. I'm distracting. Okay, very good. I do my dorsal glide. Relax. Take your head back. Relax. Distract. Dorsal glide. Anteriorly rotate for me. And I do an over rotation without breathing. Make sure that the space between occiput and C2 is released. Relax and let go. Very good. make sure that the side bending remains as easy on the left side. Fantastic. You're doing wonderful.
Feels good.
Yeah. Very nice. Now I'm going to say 1/3 side bending, very easy. 1/3 extension, 1/3 rotation. Stabilize him. Rotate to the right with the inferior oblique. Fold, 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 fold. Relax. Now I say rotate your head to the left from the same position, and I don't let him rotate to the left. So now I'm using the left rectus scapular anterior minor to hold atlas up and forward on occiput. Relax and let go. I side bend him a little bit more. Extend on the right. Rotate on the right. Rotate to the right. Rotate to the left. Or here. Relax. I may distract in the same direction of the head. Bring him back to neutral. Side bend him, pushing C2 towards the left side to side bend him to the right, the spinous process. Extend on the right. Extend on the right. That's as far as he can go in extension. Rotate to the right. Very gentle. Hold on the right. Hold on the left. Distract. Bring him back to neutral. Distract. Release the tension between occiput and C2. Do a gentle nodding. Very good. I distract. This is the axis for rotation. Go towards the left. Very good. Now go towards the right. Not bad. Go to the left. 50% to the left. 50% to the right. Always holding the head. Distract. You put the cervical roll. 15 degrees cranial rotation. Rotate anteriorly. Raise your head 1 centimeter and stretch back. That's as much head and neck flexion I would do in all my headache patients. I would never take him into full flexion of the head and the neck. Never. Very good.
Once they have a normal lordosis.
By the time you get there, the patient is never going to come back to see you. It's been too long. Hold your hand there. Right? So this part of your hand now is supporting your lower cervical spine. Just drop your head towards that side. As long as they side bend the head towards that side, don't try to be too specific with them. Side bending, rotation, extension is too much. Just side bend. Drop your head towards that side. And with this hand,